Hello everyone, welcome to our Lunch and Learn on Teledoc. We're here with Steve from Independent Health, and he's going to fill us in on how to take advantage of this nice benefit. Steve?
Thank you, John. Again, hello everybody, hope everybody's safe and well. My name is Steve Gout. I am from Independent Health, and I am the account manager for the Resource Center. Today we want to talk about the Teledoc benefits, and hopefully you'll be able to, you've already logged in and began to use it. If not, we'll kind of cover all the steps, and then if you have any questions, feel free to ask. So one thing you may have heard is something about telehealth. With all the changes with this, the COVID-19 virus, there is a difference between the telehealth and what they consider telemedicine or teledoc. Telehealth is visits with your physicians here in Western New York, whether it's telephonic or electronically, either with a secured email or, let's say, a patient portal. The telemedicine or the teledoc benefit that you have, you can actually reach a board-certified state-licensed physician 24 hours a day, 7 days a week, no matter where you are in the country. So this benefit is wonderful if you have children who are, say, away at school, because we already know that when they get sick, the first pair of people they call is mom and dad. So if you set up the account for them, they can easily reach a physician. And the nice thing is that this physician, if they feel that they need prescription, they can call it in right to a local pharmacy, because we have participating pharmacies nationwide. I think we have more than 50,000 pharmacies nationwide. So it's easy enough. They can utilize the benefits, get a prescription if needed, and they can all do it from their dorm room or wherever they're at. So it's a wonderful, wonderful benefit. So that's the two differences between those. And what I want to do is I just want to show you some information that I did send to John. So if any of this information you need, John should have it available. If not, I'll send it back to John and he can share it with you. First part is the teledoc. So this is the telemedicine benefit. It does give you where you want to log into. So when you create the account, you're going to go to teledoc.com/IH. That is specific to the Independent Health benefits. This will kind of walk you through some of the steps, but this is really what you want to do is this is for using of your non-emergent sort of services, as it explains, like colds, the flu symptoms, bronchitis, allergies, those sorts of things. Something that you may either see your primary care physician, or maybe you may even go to an urgent care center. So this is the nice thing about kind of utilizing this benefit. If you cannot make it to either your doctor's office or an urgent care center, again, it's convenient because you can reach a doctor either via a telephone or a secured video conference, whether it's on your computer or actually on their mobile app. You can use it right on your phone. The nice thing with this is in normal times, knowing that this is definitely different times with this COVID-19 virus, at most times the average callback time is about 10 to 15 minutes. Unfortunately, during this crisis, the wait times have been much longer. I've heard some are possibly close to an hour wait. So unfortunately, everybody else is using this sort of benefit. So please be patient. Again, as I mentioned, with these teledoc physicians, they can write prescriptions depending on your diagnosis. They can also notify your primary care doctor for any of these visits that you may have. So one of the main questions that comes up is, how much does this teledoc benefit cost? Well, it depends on the plan that you're enrolled into. If you're enrolled in the green plan, it's a straight $10 copay for each and every visit. If you're on one of the HSA or the non-HSA plans, it's going to be your deductible, then a $10 copay. If you haven't met your deductible, it's only a $45 cost, which is actually much cheaper than a normal sick visit, say, going to your primary care doctor. So it's a nice benefit to have. The other good thing with this is the teledoc services can be used. You can use your HRA dollars or your HSA dollars to help cover these services. One of the most important things to do is to actually set up the account, because you can't take advantage of it without actually setting up the account. So what we'll do is let's go here. So what we'll do is you're going to want to look to see about setting up the account. Again, as I mentioned, you're going to go to teladoc.com/IH. You're going to put in your member ID number, and I believe it asks for your name, because it has to look out and verify that you do have this benefit. Once it does, you're going to go through the steps and complete all the necessary information. It takes generally about 20 minutes or so, depending on how many members you have covered on your plan and what sort of extensive health history that you might have, because the main part of this is you're going to be talking to a doctor who does not have, this will be the first time that you're actually meeting them. So the main thing to do is, once you get it set up, one of the things, again, is to put in your complete medical history, any sort of allergies, anything else. So it's quite extensive, so definitely take your time and put as much information as you can there. The next thing, it just kind of shows you how to get started. This is really simple and easy. Again, as we mentioned before, you can reach a doctor 24 hours a day, 7 days a week. So as I mentioned, you're going to go to the teladoc.com/IH. You're going to set up the account. And again, this is something simple. I'm not going to walk through it all because it's fairly simple. But this information is available in case you want to reference it as you're going through that. There are 3 ways you can set up the account. Again, you can go online, as it mentions. There is the mobile app, which you can go find at either the Apple Store or the,
Android.
Google app. I can't remember what the Google Store is.
The Google
They
Play.
do say you can call Teladoc, but again, because of the call volumes, I don't recommend that. Just the fact is, it'll take you a lot longer to do that. So anywhere online, if you are going to get the app, you're going to look for that symbol, that purple circle over the light blue line. That is the kind of Teladoc trademark. So you can look for that, you'll download it, and you can use, once you actually set up your account and you create that username and password, you can either use it again on your laptop, or it's the same login that you'll use on your mobile app. A few more things I want to mention is when you're setting up your account for yourself and any children under the age of 18, you can set them all on one account. If you have, let's say, a spouse or children over the age of 18, they do have to create their own account just for privacy reasons. And so, again, more information, it's fairly simple, straightforward. And again, John has this all available for you, so it's definitely something, but it's just, again, just for privacy concerns, you can set yourself up along with any children under the age of 18. Anybody over that will have to set up their own account. Okay? I also provided some frequently asked questions. So again, this information is available. If you wanted to review it, you do have questions. Again, at the end of this, if you're logged in with us, you can ask questions. I'll be happy to answer them for you. But one last thing that might be helpful is, if I can get this down, there we go, is there is also a link up here. There's actual video on YouTube that will actually walk you through it. So unfortunately, the volume on my computer doesn't work, so you can't hear any of it, but I want to kind of show you just the first part of it, because it's about a 5-minute video, and it's very insightful, and it actually walks you through the steps on getting in it, and then how you can use that benefit. So I just want to give you a quick show of it, just so you know what it's going to look like. But this is all it's going to be. It'll be nice, again, and it's simple. So just look for this video here. And again, I wish the sound worked. But once you have the volume, it shows you kind of all the ways you can interact with the doctors, and then we'll also move into how to create your account. So right here. Okay? So with that, I will see if there's anybody logged in. Does anybody have any questions? John, do you have any questions that you want me to answer? Or one thing I do want to... Okay.
No, go on, finish.
Yep. One other thing I did think of is, because I have definitely used this benefit for my kids. Because again, I'm not a doctor. I'm not I'm medically inclined. The nice thing with this is I've used it a couple different ways where I have used it once telephonically. Again, it works very, very simply. The nice thing is I've also used it on my phone. What I've done with it was I actually it was my daughter. We thought she had like a strep throat. We actually took a picture of her throat and we actually attached it to the website. So when we scheduled our appointment, we put the photos there. So when the doctor actually came on, they were able to look at the photos, diagnose it because it helped them, and then they were able to diagnose that yes, she did have strep throat, or at least she had a cold there, and they were able to write a prescription for that based off of just the picture. So it is actually very handy. It's just one other idea to use when you're utilizing the Teladoc benefit. So Jeff, what question might you have?
Well, you actually answered one of my questions right there. I was going to ask if you actually had any experience with actually using it to talk to a doctor, and it's nice to hear that you had a positive experience with it. A comment that I was going to make is that I can resend the link to that video to everybody so they can see that as well. I'll work on that after the presentation. But I guess one of the questions that I had was, I was just in a meeting yesterday, and we just received an email recently as well. Is there any truth to the fees being waived during this time of crisis for Teladoc, for this benefit? Do you know anything about that?
Yes. So again, with this kind of crisis, the regulations that have come out is that as I explained earlier at the beginning, there's two different benefits. There's a telehealth benefit and then the telemedicine, which is a Teladoc benefit. So the telehealth benefit, so with your conversations with your local physician, the mandates say that those are covered with no member liability.
Okay.
So if you're having conversations because you're sick with your physician, whether it's yourself or a family member, and you're doing it either over the phone or they do have a video link or maybe they're doing it through their patient portal, there is no member liability. So there's no cost to you for those visits. If you want to take advantage of the Teladoc benefit, which is telemedicine, the mandate does not include that.
Gotcha.
So you would still either pay the $10 copay on the green plan or the deductible then $10 on the HSA or non-HSA plan.
Perfect. Thank you very much, Steve.
Yeah. And as I mentioned before, again, you can use either your HRA dollars or your HSA dollars to help cover the Teladoc service.
Okay. Perfect. Thank you.
I don't know if we have anybody else on here. Does anybody else have a question they may want to ask?
I see that we got a couple people on, but I don't.
I have a question.
Perfect.
Okay.
Does Teladoc physicians be able to forward that information to my primary care person through portal, or is that up to me to do somehow?
Correct. So what you'll do is at the very end, they generally ask you, do you want a notice of this visit sent to your doctor? And you'll tell them yes, generally, because the best thing to do is we at Independent Health, we're always stressing the relationship between yourself and your primary care physicians. So the first thing that we always try to do is get you to go visit your doctor. If they are not available or unable to help you at that time, again, if you're using the Teladoc, I strongly recommend that have them send that the visit notes sent to your primary care doctor's office so they have a record of that.
Okay, thanks.
Perfect.
Any other questions?
John?
Hey, Suzette?
Steve?
Hey,
Can
Suzette.
you see the chat box or not?
I cannot. Steve, can you see the
Can
chat
you see
box?
the chat box or screen?
The chat box?
Oh, wait, hold on.
The
Is this
chat box?
Oh, there we go. Okay. So,
Oh, okay.
there we go. I'm just trying to get this. Okay. Can you see these
So here we
from
go.
Suzette, Steve?
So it looks like that Suzette has asked, is the first one is, does the $45 fee offset against your yearly deductible? That is yes. So if you are on either the HSA or the non-HSA plan, if you're within that deductible phase, the $45 will apply toward the deductible. Again, once you've met the deductible, you're just going to pay your $10 copay for that service. Let's see here. Another question from Suzette is, no cost services offered during the COVID-19 outbreak. Here. Yep, so the services, as you mentioned, that are covered in full based off the mandate are the actual testing for the COVID-19, the actual professional service that goes along with the testing, and if you happen to go into like the emergency room, be treated there to be tested and such, that too is covered with no member liability. But any other treatment, so once you're diagnosed, if you have the COVID-19, those are the parts that are actually covered in full. If you say you then needed prescription medication or something else, or if you are admitted into the hospital, that's all going to fall under your normal benefit. So whether it's the copay on the green plan or the deductible and the copays on the HSA or non-HSA plan.